Hello and welcome to another episode of Easy IVF. Today we'll be talking about IVF add-ons and are they really worth paying for? When you choose IVF add-ons, what are the kind of red flags you might want to know before paying for that extra add-on when you think about having a successful IVF? So I've kind of previously explained that IVF add-ons are extras that might be offered to you in a clinic on top of your normal fertility treatment at an additional cost. Some of these emerging techniques have shown promising results initially, or at least some of them they have been around for a while, but they haven't been proven without doubt to improve pregnancy or live birth rate. In this video, I'll briefly introduce and explain the most common IVF add-ons and also highlight the associated risk. I'll also point out some evidence-based research that is linked to the study, and finally I'll rate the add-ons. They'll be rated based on randomized controlled trial where patients are assigned randomly to two groups. A treatment group receives treatment and a control group. So the control group, they might receive placebo or a normal treatment without any add-on. Recently in the news, there's been a buzz from the Human Fertilization and Embryology Authority in the UK. They've been urging IVF clinics to be more transparent about the information they give out to clients when it comes to IVF add-ons, especially those that have no conclusive evidence that they actually increase the chance of pregnancy or live birth rates. So I did more digging and review from the HFEA website, which I'll put a link below. You can get more of this information yourself. I'll be giving a green symbol for IVF add-ons with more than one good randomized control trial that shows that the procedure is safe and effective. So green button for a procedure is safe and effective, and amber button for a procedure that has a conflicting body of evidence, meaning that further studies or further research is required and the technique cannot be recommended for routine use. And a red symbol for studies or add-ons that have no evidence to show that it's effective and safe. All right, so let's dive in. The first IVF add-on I'm going to review today is intracytoplasmic sperm injection, normally known as ICSI. So back in the days, IVF was very traditional, where there's just a combination of sperm and the egg before the introduction of ICSI. In most IVF clinics now, ICSI is a sort of the gold standard. Yeah, most patients are put through ICSI. So I have a full video on ICSI. Please just watch my previous video for that clarification. In most clinics, ICSI is integrated into the cost of your treatment. So whether you are doing a traditional IVF or IVF with ICSI, you pay a flat fee. Some of the risk associated with ICSI includes damage to the egg, multiple pregnancy rates, and birth defect, which I've also explained in that video. ICSI technique, however, is very efficient and can benefit more patients than others. So for ICSI, it's a green button, yes. Weigh your options if there's an additional cost to ICSI, and see if your sperm parameters are good enough. You can skip ICSI and just do IVF, but just weigh your option and talk to your physician before skipping ICSI. Now let's get down to the main ones that that you really need to open up your eyes and listen carefully when they're talking about that in the clinics. The second one is assisted hatching. The embryo has a zona, and a zona is a layer of cell that surrounds the embryo. Assisted hatching basically means using a laser to kind of make an opening, to create an opening in that zona pellucida for the embryo or for the inner cell mass to be able to come out and implant into the uterus. Now, the embryo needs to hatch out from the zona to implant. People think that assisted hatching using acid or laser can thin the zona or make the hole to help embryo hatch. The risk associated with this, however, is that you can actually damage the embryo during the procedure. The National Institute for Clinical Excellence that advises doctors also says that assisted hatching is not recommended because it has not been shown to improve the pregnancy rate. They also say that further research is needed to find out whether assisted hatching has an effect on birth rates, and also to determine the consequences for children born as a result of this procedure. Some clinics believe that assisted hatching can lead to higher birth rates in very select cases. For example, it's been noted that actually that zona pellucida is thicker in older women. So the zona pellucida of embryos in older women tend to be thicker, right? So weakening or thinning the zona pellucida in those patients may actually help the embryo hatch, but this hasn't been proven. So for assisted hatching, it's unfortunately a red. Yeah, guys, it's a red from that one. Now let's talk about freeze-all cycle. In a normal IVF cycle, one or two embryos is transferred and others are frozen. In an elective freeze-all cycle, viable embryos are frozen and no embryo is transferred during the first cycle. Embryos are thawed months later and then they are transferred back. Now, there is some evidence that the body hormonal response to fertility drugs can affect the lining of the womb, which makes it more difficult for embryos to implant. So freezing the embryos means that they can be transferred back into the woman when the lining of the womb is well developed. It's also thought by freezing all the embryos, women will be exposed to lower risk of having ovarian hyperstimulation syndrome from the introduction of hormonal drugs into the body. So you prevent the woman from having what they call OHSS due to response to drug. I'll make a video just to explain all the side effects or risk associated with IVF and the use of hormonal drug. There's also a study that suggests that birth weight of babies born from normal fresh IVF cycle is lower than those born from frozen embryo cycle. So since birth weight is associated with the risk of disease in later life, freeze-all cycle may be safer for the baby. So that's just an argument. Anyway, that being said, the risk of doing a freeze-all cycle is, if you choose to do a freeze-all cycle, not all the embryos would survive thawing. There's a possibility that all of them would not survive thawing. And if you have 1 to 2 embryos, do you really want to risk freezing them and thawing them and not having anyone survive? If none of them survives during thawing, then you've lost out everything during the cycle. And that thing you might want to consider is, like, there are a lot of randomized trials out there saying that a fresh cycle is better, and a lot of these trials also suggest that a frozen cycle is better. So till now, most doctors and most clinicians do not have enough evidence to ascertain which one is actually better, a frozen cycle or a fresh cycle. So for this one, guys, it's an amber. All right, the next one is embryo glue. Glue. Ink, chunk, sticky glue. Right, so when you think about glue, it means something that holds something. Embryo glue is something that holds embryo in the uterus. So the implementation of embryo glue into the IVF lab or during the transfer is to actually make the embryo stay in place. That's the idea, that's the concept. So the glue contains hyaluronan, which may increase the chances that the embryo would implant. This embryo glue is added to the transfer media before the embryo is loaded into the catheter, right? So for transfer. So far, there is no known risk associated with using embryo glue. Research from one of the Cochrane studies showed that embryo glue containing hyaluronan increases pregnancy and live birth rates by 10%. There is one high quality study in this review that shows that the use of embryo glue improves pregnancy and live birth rates. However, studies in the review were of moderate quality. A further higher quality study needs to be conducted before people can actually have confidence in the benefit of embryo glue. So you can't really tell by doing 1 or 2 studies. Did the people doing this, the study have any conflict of interest? Was the result manipulated? This needs to be replicated in various clinics and in various countries for them to have a unanimous agreement that embryo glue actually works. So for this one, guys, it's also an amber. Sorry to bust your bubbles. Let's talk about endometrial scratching. Scratch. So in order to have a successful pregnancy, an embryo needs to implant in the womb. If that doesn't happen, the woman would need to start her cycle again. This is heartbreaking for sure, but like people go the extra mile to kind of like, you know, figure out what's happening. What do I need to do to make sure that the embryo stays? Some people would use embryo glue, some people would do endometrial scratching. So most embryo don't implant because they've been unable to develop fully to the implantation stage, or because of the developmental mismatch between the stage of the embryo and the lining of the uterus. So if there is a mismatch in the lining of the uterus and the embryo you're putting back in that lining, obviously you won't implant properly. If you're putting a day 5 embryo into a lining, into a day 3 lining, or if you're putting a day 3 embryo into a day 5 lining, there is a mismatch. There's possibility that that embryo would not implant. In a small number of cases, an embryo won't implant because the lining of the womb is also not enriched. It's not the right environment for that embryo. So endometrial scratching is done before IVF, and during the procedure, the lining of the womb, you know, or the endometrium, as you may call it medically, is crushed using a small sterile tube, you know. And that the theory behind this is that the scratching would trigger the body to repair the site of the scratch, right? And that would release some sort of chemicals and hormones that would make the womb lining more receptive to embryo implanting. Some people also suggest that the treatment may activate genes that make the womb lining more receptive to an embryo to implant. Now, what's the risk associated? So say for example, you have an infection in your lower cervix before scratching, and this may actually introduce infection into your uterus, and that may cause a serious problem for you. So guys, for this one, we'll give it an amber as well. This is because there's currently 3 clinical trials that is looking into endometrial scratching, and the early findings suggest that the benefit of using this procedure may be less certain than they initially thought, right? So I'll keep you guys in the loop if anything comes up.